As Americans face a global pandemic, the state of Iowa is also confronting the social and economic challenges. We sit down with a trio of Iowa experts to dive into unemployment, legal issues, and health concerns in the era of a coronavirus outbreak on this special hour-long edition of Iowa Press.
Funding for Iowa Press was provided by Friends, the Iowa PBS Foundation, the Associated General Contractors of Iowa, the public's partner in building Iowa's highway, bridge, and municipal utility infrastructure.
I'm a dad.
I am a mom.
I'm a kid.
I'm a kid at heart. I'm a banker.
I'm an Iowa banker.
No matter who you are, there is an Iowa banker who is ready to help you get where you want to go. Iowa Bankers, allowing you to discover the genuine difference of Iowa banks.
Celebrating nearly 50 years of public affairs coverage on statewide Iowa PBS. This is an Iowa Press special edition on the coronavirus pandemic. Here is David Yepsen.
As a global pandemic spreads throughout the country, Americans face unprecedented changes to daily life. And many Iowans have important questions pertaining to their health and safety, with the potential of infection. Joining us to discuss these concerns are Iowa Workforce Development Director Beth Townsend, Dr. Rossana Rosa, an infectious disease specialist at UnityPoint Health, and joining us remotely is Iowa Attorney General Tom Miller. General Miller, thank you for being with us.
Thank you, David, for having me.
Also joining us at the table is Erin Murphy, Des Moines Bureau Chief for Lee Enterprises. Now, we've expanded our regular format on Iowa Press to a full 1 hour, and you can see the many ways to submit potential questions for our experts via email and social media or through our 800 number listed on the screen. We'll incorporate some of your questions into the back half of the program. And as we begin this discussion, we'll take a look at the unprecedented level of weekly unemployment claims in Iowa the past 2 weeks, eclipsing previous spikes during the recessions of 2001, the recessions of 2008 through 2010. Director Townsend, what are we looking at here? What does this tell you?
Well, it certainly is unprecedented and historical. But what sets it apart from the recession is this was such a steep and almost immediate or overnight spike in unemployment claims. So the week of the 16th of March is when we first started to see the number of claims increase dramatically from what we had seen in Iowa. We've been so blessed in Iowa with very low unemployment for a very sustained period of time. And so to go from 45,000 unemployed in 1 month to 40,000 unemployed in a single week is a dramatic change.
You know, some people have contended it's a hard time to get through to your office, that the volume of calls seeking information about getting benefits. How are you handling that? How big a problem is it?
Well, we normally on a given day we would get maybe 400 or 500 calls a day. This past week we've averaged 21,000 calls a day. So we early on we retrained much of our staff that were not working in the area of unemployment insurance to be able to work in the call center. So we've deployed about 250 staff workers who are working primarily from home to be on the call center. I do know that when you call and go through the menu to select what service it is you need, that you will hear the phone ringing for 3 to 5 minutes. That's on your end, and that's just unfortunately the way the system works. We are there to answer, and if you just hang on the line, get through that ringing, it'll then go silent for a few minutes. It's taking us 15 to 20 minutes to answer for the most part. And so if you just call, hang on the line until you hear a voice on the other end, they will get you the help that you need.
So 20 minutes?
Roughly.
Okay.
Yes.
Erin?
Dr. Rosa, one of the great debates going on right now in Iowa is over whether the Governor Kim Reynolds should issue a shelter-at-home order for the state. Iowa is one of only 5 states that has no shelter-at-home order for any part of the state. In your expert medical opinion, should Iowa go to that? Should Iowa join the other states that have shelter-at-home orders?
You know, I think it is important to acknowledge what Governor Reynolds has done so far. Indeed, she has taken many measures aimed at keeping people at home, and she has issued recommendations for people to stay at home and only leave their house for essentials. I think some of the concerns that many, medical groups might have, many, healthcare providers like myself might have, is that we are not sure if some people are actually taking that seriously. And then we do think that's, we wonder would actually something more strict and formal would really bring home that message that the only thing that will get us through this is physical distancing, is staying at home.
And that's kind of gets at the whole voluntary versus mandatory question, right? And we hear that from readers and viewers all the time as I see big groups still going out and doing that here. Is that what you're getting at, what you're
Yeah.
what last?
Yeah, I do think that, and in a way, I recognize that it's a very Iowa thing to say, to expect that Iowans will do the right thing, because that is, that's my experience, as somebody who moved here from, from another country, from another state. I've seen that Iowans, are people that in general, take things seriously, are very mindful and law-abiding, but these are extraordinary times. We don't need a majority. We need everyone to heed this advice.
And then what are the added public health benefits? And you might have touched on that a little earlier, but it made me expand on that. But when you go to that order and people are actually required to stay home other than for emergency or essential trips, what are the added public health benefits of that?
Yeah, so, when it comes to the spread of the virus, it's a numbers game, essentially. A lot of, the virus spreads from person to person. And not only that, but it's only the amount of opportunities that the virus will have to come in contact between people. And, so the more opportunities there are for people to interact and to interact in close proximity, that is what will sustain the infection and sustain the spread. The chains of transmission are invisible. We cannot see them, but they are there, and we are the vectors for this, actually. So those chains of transmission will only be cut. The rate of spread will only be cut if people stay home.
Mr. Miller, I want to go back to this question of shelter in place. If the governor were to issue such an order, how would things be different? It already seems like we're being asked to stay home and store, our businesses are closed. Is this just a semantical argument that we're having or discussion? What difference would it make if she did declare that?
Governor Reynolds has, issued executive orders on a number of these issues, and has really come close to a shelter-in-place or a stay-at-home order. It's almost virtually the same. Assistant Attorney General Heather Adams prepared for me a diagram today in terms of businesses in Minnesota, which has an order, in Iowa, which doesn't, and it's virtually the same. So it's very, very similar. That there would be some more enforcement opportunities, but states that have shelter in place, are not going out and arresting people or issuing citations. There would be a little different process in terms of what businesses are open and how that would go. But as I said, Iowa and Minnesota turn out to be roughly the same. So it's really quite similar. And Dr. Rosa is right that it's a question of people's compliance. And I would just ask all Iowans to comply and stay at home, stay away from people, exactly as the governor has asked and others has asked. And speaking of Dr. Rosa, you know, I have just such great admiration for the medical profession. I was born and raised in a family where my mom was the saint, and one of many reasons she was the saint is she was a nurse. I've had great respect for the medical profession, and never more than today, of course, what they are doing in risking their lives and their health for the rest of us is extraordinary and should be very uplifting for all the rest of us.
Well, General, I agree with you. My mother was a nurse too, so we're in agreement there. Go back to the issue.
We have advantages of being raised well.
That's right. Go back to this question of shelter in place. Some local communities around Iowa have wanted to do this on their own. And they first were told, yes, fine, and now they're told, no, they can't do this. Whatever happened to local control?
Well, you know, home rule is what you're talking about. But home rule does have some limitations. And the basic limitation is that it can't be inconsistent with state law. And that's what happens here, that this is an enormous pandemic and health crisis, and the governor and the Department of Public Health have taken actions, very comprehensive actions. So they have sort of occupied the field. They're not sort of, they have occupied the field, the presumption concept. And the other thing is that on home rule, a city or a county cannot permit something or prohibit something that's permitted by the state. So it's a matter of preemption, and it's a matter of the full part of the home rule language that it can't conflict with state policy, state orders.
Well, do you think the legislature and the governor should get some clarifying language? Because it's pretty clear that Iowa City and Cedar Rapids have one kind of problem, and people in western Iowa have another kind of problem. So it would seem reasonable that their response might be different than what you expect in northwest Iowa, for example.
Well, you know, there certainly is. There's certainly an argument there. There is also an argument for a statewide policy that this is something that the Department of Health has the expertise. The governor has the authority. That while some places may not have exactly the same problem now, potentially they do. And of course, as we have said, if the governor decided, the governor can delegate this authority to cities and counties. That's an option for her.
Director Townsend, we wanted to get your perspective on this too, from an economic and workforce perspective. Governor Reynolds said, I believe it was today at her daily news briefing, that even under a shelter-at-home order, roughly 80% of businesses in Iowa would be classified as essential anyways and remain open. But for that 20% that wouldn't be, do you have concerns when you look at that as far as an economic impact or on the state's workforce, what adding those extra businesses and those closures and what that could further do to what's already happening in the Iowa economy?
Well, we are appreciative that we are still open for business in the sense that so many Iowans can continue to work. When you think about it, we have in February, we had 1.7 million Iowans in the workforce. So even if you have, as we did this last week, a little over 100,000 weekly and continuing claims, that's still 1.5, 1.6 million Iowans who are able to go to work. And there is nothing like economic security to help alleviate the anxieties that a lot of Iowans face. I think we've seen a lot of the surge that we've seen are from those businesses that have been closed, like the restaurants and the hospitality industry. This week we started taking claims for the self-employed, the gig economy workers, the owners of those restaurants and bars and things that have been closed. And so I think we've seen a lot of that already into our unemployment claims, and we're fortunate that we have so many people who can still get up and go to work in the morning.
Director Townsend, people hear all these stories about Congress passing more aid and people being included in benefits going up. And the question immediately comes to mind, well, when do we get our check? We hear about more benefits and
Right.
people getting benefits who didn't qualify before. what is a viewer supposed to think? When can they expect to see some of this aid? How do they go about qualifying for it?
Sure. So the CARES Act, which is the one that provides the unemployment benefits to the self-employed, independent contractors, nonprofit employees, and gig economy workers, and then also provides that $600 weekly benefit that those who are receiving unemployment qualify for, was passed and signed into law last Friday. So DOL issued guidance. We received guidance last night.
From the Department of Labor.
Yes, that we needed to be able to implement. These are new processes. You know, we don't normally provide unemployment benefits to the self-employed, so that's a new process. We also don't pay additional money beyond unemployment benefits, so that's another process. But we are confident that we're going to be able to start getting money out the door, get those programs implemented in the not too distant future. And by that I mean within the next several weeks.
So someone who calls in and waits for 20 minutes, will they be able to get some answers about their specific situation?
Absolutely. Well, it's the same answer for questions relating to when am I going to see that $600 weekly benefit. And people need to keep in mind that those benefit programs started March 30th. So as long as you have filed and are qualified for unemployment, and it begins March 30th, then when we do start implementing those payments, you will be paid retroactively. So let's say we're able to get payments out the door by the 15th of April, then you would get those 2 weeks of payments in one lump sum, and then you would get a weekly amount thereafter.
And is there anything being done to simplify this process? I read in my old paper this morning this list of things, what you have to do to qualify. And, you know, somebody doesn't have to worry about collecting unemployment, because if you understand this stuff, you got a job in law firm. Well, I mean, this is very complicated processes.
It's not actually, David. It's not that complicated. So we have put made and posted on the website videos to walk people screen by screen how to fill out and complete an unemployment form. Because remember, most of the people who are filing unemployment claims now have never filed them before. Right. So we've done a video for the people who are filing because they work for an employer and have been laid off. And then we've also today posted a video to show individuals who are self-employed, because their answers are going to be a little bit different, so we want to show them how to do that. They have the option of uploading a number of different documents to show their wages. It's not a cumulative list, like you have to file all these documents, but you just have to show one so we can establish what your income is. Because if you're employed and earn W-2 wages, we have access to your wage records. We don't need those documents because we already know what you're making. If you're self-employed, we need some form of documentation to show this is what my income usually is. That can be a 2018 tax return. That's the one document that will get you there. It could be your 2019 tax return if you've already filed that. It could be your 2019 1099 form from the IRS showing what you made as an independent contractor or self-employed. So it's not like you have to provide all of the documents. You just need to provide documentation that establishes your income. And because unemployment is based in part on your income, it helps us make sure that you're getting all of the weekly benefit that you're entitled to.
So that video will help us understand.
I believe it will, yes.
Erin?
Dr. Rosa, I wanted to ask you about, there's modeling out there and projections on the potential impact, the coming impact of this virus in the coming weeks and months. One of them that's put together by some experts in the field, and a lot of people cite, is out of Washington University. It sounds like you're familiar with that. So according to that projection, and these numbers change from day to day, but they project roughly not quite 1,500 deaths in Iowa, with the impact reaching all the way to August. Is that a projection, modeling we can rely on? I know the governor expressed some concern that one might not take into account some of the steps that you noted earlier. Is that a good projection, or do you question those numbers too?
Well, the thing about modeling is that at the end of the day, they are predictions. And when the scientists that have put together these models, when they decide what to include and how to calibrate the different variables, they have had to make a lot of assumptions. And that means that they put in there is not exactly hard data. It's of course a very well researched, very well educated assumption, but it looks at a different range of things. And that's why when you see when you see what their estimates are, they are an average around 1,400, but then really could be much more than that. Indeed, when you look at their website, they have us in Iowa listed as having no shelter in place, no closures of any type. So that may be something that could potentially impact how those numbers come out. But our daycare centers do remain open, which might be different than from some other states. And indeed, there's no shelter in place order, so they also have to take that into account. They are predictions at the end of the day. Yeah.
We have a graphic that we want to show our viewers and ask you about that shows the number of cases in Iowa and in the different areas of the state. I think you mentioned in there some hot spots, so obviously there's some of that, and that's the number that the state is looking at too. Just when you look at that map, what does that tell you? What conclusions do you draw when you see that?
Well, actually, when I look at the map, what I can tell you is that what we are missing is where we're not able to test more. I actually have no doubt that the virus is spread throughout the state, and perhaps the intensity of what we are seeing, the number of cases, might just reflect an increased awareness or local modifications to the testing criteria. But I see some blank spots. I don't think there are blank spots. I think it's all across our state.
How much does that lack of testing, and there is testing available, but because of the numbers, we kind of have to prioritize, right, who's getting the tests right now. How much does that lack of more testing inhibit the states and federal responses to this?
Testing affects every single aspect of what we can do for COVID-19. If we had more tests, through testing, you are able to identify and appropriately triage to the necessary level of care. You are able to isolate and perhaps not just say to someone, maybe you have COVID, so you should isolate, but actually be able to say you have COVID, isolate, and you're able to trace. So testing is fundamental. And right now, our testing is really narrowed to try to capture those ones who we really think might have COVID-19 and are at risk for worse outcomes or death. So, yes, our testing situation is much improved than it was a couple of weeks ago, but it is by no means resolved. We need to do more tests.
Attorney General Miller, one question that comes up right now is about evictions. And the governor has put a hold on them, but that was good till mid-April. What do you say to a tenant or a landlord a tenant who is facing evictions? What happens to them? What does the landlord have to do? What's the situation?
Well, I think that the suspension of evictions would run at least till April 30th. I think that the governor extended essentially her whole set of regulations, so it would be till the 30th, and that could be extended.
Even beyond the 30th, it could be extended.
It could be extended by the governor. Yes.
Yeah.
We don't know how long this whole period is going to last, or any part of it, so it could be extended. So I think that was a very good move on our part to suspend the evictions during this period of time, and for the tenant, I think that it provides some safety and security at a point of great insecurity and lack of safety. I think if the tenant can pay the rent, the tenant should keep doing that. I think that the landlord should understand the times that we're in, and that raises a really important point for me, and that is that one of the things we need to do is treat each other well. A bit of kindness, a bit of graciousness at this time, of reaching out and a landlord treating a tenant in a contentious period in a reasonable way is a really good example of us treating each other the way we should. And I think that whole important element is extremely important.
Mr. Miller, I want to ask about another subject. What about martial law? Are we headed to a point where the government, the state, has to get much more coercive, much harsher with people, where this voluntary approach doesn't work? You hear that word thrown about. What does that word mean to you? Are we headed toward something draconian like that, where the police do have to get involved? Talk about that a little bit for me, please.
Yeah. As someone who's a great believer in the rule of law and government functioning the way it should, martial law is very foreign to me. It's something that I'm opposed to. I don't think it's going. I don't think it's going to happen, and shouldn't happen. We should think of South Korea. South Korea has probably done the best job of any country on this. They haven't gone to those draconian measures. But I'll pick up on one point that Dr. Rosa was making, that is on testing. They did a terrific job on testing, and they did it early, and that made just a huge difference because they were able to find out exactly who had coronavirus, isolate that person, chase down the people they were in contact with, and that was a huge factor. So I think I want to sort of double down on the idea that the more testing we do and the more tracing and tracking that we do, the better off we're going to be. And we've been, we in Iowa and the whole country just have not been able to do enough testing because we didn't have the testing kits.
Director Townsend, I had a couple of classifications of workers that I want to ask you about, and a couple of them you may have already gotten to, so maybe just touch on that again real quick. Self-employed and gig workers, gig economy workers, the Uber drivers, those kinds of folks. They have options currently.
They qualify for unemployment benefits, and we've started taking those claims.
Okay, and how about workers who have lost both their job and their health insurance? What options are available for them?
Well, obviously, if they are entitled to or qualified for unemployment benefits, then they could apply for those. With regard to the loss of their health benefits, that's not a factor in determining the amount of the amount of unemployment benefits that they're normally entitled to.
And do you ever get those questions of people? Where do I go for?
We have not received many of those. Fortunately, I think a lot of employers have kept their employees on their health benefits, even if they were laid off. So they furloughed them and laid them off, but have taken the responsibility of paying for those health insurance benefits. And I would encourage all employers to continue to do that. Also, under the Paycheck Protection Act, which loans were starting to be made today, provides the employer with money to pay for wages and benefits. So that's also an option to keep people on their health insurance.
And you touched on another one there, furloughed workers, real quick, that people who are off now but have a job hopefully at the end of this. What are the options for them?
Same as for anybody who's been laid off. They're entitled to the unemployment benefits as long as they are furloughed or laid off.
Dr. Rosa, should we all start wearing a mask?
Well, the CDC has, now issued recommendations for essentially public masking. It is very important when we think about masks that we make a distinction between medical masks and non-medical masks, the cloth masks, the do-it-yourself masks. Medical masks, the N95 respirators and surgical masks, we still need to save those ones for healthcare workers. That is because that level of protection is needed when you are performing procedures on infected patients, or even when you are performing routine cares that bring you very up close to a patient. Now, in terms of the role of cloth masks, we think there is some evidence that wearing a mask, appropriate mask wearing, can prevent spread of the disease. The virus is spread through droplets, and droplets are put out there into the world when you talk, when you cough, or when you sneeze. So if you're covering your face and you are either symptomatic or perhaps still too early in the disease to show symptoms, but still to be able to spread it, if you're wearing a mask, then that can minimize that burden. Now, the next question is, do masks help in prevent acquiring that infection? And that is the thing that is not entirely clear. One thing that worries healthcare providers in general is that inappropriate mask use can actually put you at an increased risk of acquiring that infection. If the mask is not fit enough, if you're actually all touching your face, touching your eyes, just like pulling it down, then actually that can put you at risk of contaminating yourself and then allowing the virus to enter. And then the other thing I really want to emphasize is that we don't want people to be lulled into a false sense of security, like, oh, I now have my mask and I can go out and mingle with my friends. Using a mask is not a substitute for physical distancing, washing your hands, and keeping your surrounding surfaces clean.
The other question that comes up is immunity. If you've had the virus and recovered, do you have immunity?
Mm-hmm. Well, data studies coming out of China show that the overwhelming majority of patients, so more than 95% of the patients, do develop antibodies, so protection against the virus, about a couple of weeks after the onset of symptoms. However, we do not know if those antibodies provide full protection, nor do we know for how long do they last in your body.
We're going to turn to some questions from our audience. And while we're shifting gears, and Erin's going to get ready with a question here, I'd like to ask Attorney General Miller one last question on this round, and that is about scams. What, if anything, has your office seen about fraud, hoarding, people scamming? We got a problem yet in Iowa?
We do have a problem on price gouging, which is related to hoarding. It's a part of hoarding, and indeed we've had well over 200 inquiries to our office and over 50 actual formal complaints. What we're seeing is in some places it's in the supplies, both at brick and mortar stores and online. Cleaning solutions, sanitizers, disinfectants are being well overpriced. What we've done is whenever we get a complaint, and we're being proactive in trying to get all over the internet to see where there's instances, we as quickly as possible have a very dedicated consumer protection staff push back on whoever is doing this. Online, we will, if there's a chance to comment, we put our opinion up. We issue cease and desist orders. And we work a lot with other states and other people in law enforcement. The law enforcement consumer protection community is really a very good community. For instance, we work with other states in dealing with Amazon to try and get them to, as quickly as possible, take off their sites advertisements that would be price gouging. We work with the two U.S. attorneys' offices for more large-scale scams beyond price gouging, and they would be things like claims that they have a vaccination or a treatment or a cure. There is none out there. They're all fraudulent, and also there's a form of what we call phishing that they'll contact you and say that they're from the IRS and want to expedite your payment or go through that. And what they're looking for is your bank account number, your Social Security number, and they use that for identity fraud. So that there's a fair amount out. We're pushing back, and a number of the merchants we're getting some cooperation, which is important. But this whole area is something that's unfortunately very predictable. Whenever there is a situation like this, the con artists are topical. Whatever is on people's minds, they gravitate towards, and nothing's been on our minds as much as this pandemic.
Well, we're going to switch gears now and go to lots of the questions that we're getting from from our viewers. Erin?
Yeah, I got a question. I think, Dr. Rosa, you're best equipped to handle here. It comes from Tricia, who submitted her question on Facebook. Her question is, why are different counties getting test results back faster? And I may spread that even more for you. And we hear anecdotal stories about some people having a harder time with tests than others. How long should this be taking? And we've got the State Hygienic Lab doing tests and private companies doing tests too. How long should it take, and how uniform is this process?
Yeah, so testing is still a patchwork of different pieces. So depending on where a test sample is sent, that is, that's why there may be variation. You know, initially when testing was expanded, this was done through national reference labs, but you know, we were not the only state sending them tests. It was happening all across the country, and so that their turnaround times were between 3 and 7 days. And so some clinics may still be testing through those reference labs. The State Hygienic Lab is another one, and I think their turnaround time might be a little bit faster. We do have in-house testing now at UnityPoint, but we are actually processing samples from across all of our state, so that, you know, we have to prioritize hospitalized patients. So those samples, you know, then might take between a few hours and up to a day. And if we are running some clinics from across the state, then that may take a little bit over a day. So because there is no unified place where all of the samples are going to, that's why you see this big range in turnaround times.
Doctor, real quickly, Ron in Sheraton asks, if a person with the virus coughs or sneezes into a cold air return in the furnace, could that make it throughout the house?
You know, I am not a structural engineer, so I don't know if I'm the person best equipped to answer the question. I should notice, though, you know, that you know, even things like, you know, if you have a large gathering, even the number of air turnovers that you have in an hour can potentially impact how many folks get infected, but. You know,
we'll have to get a structural engineer on this program. Director Townsend, unemployment is a viewer. Can my employer force me to come back to work in the office? I've been working from home this week due to possible exposure, but they're telling me I have to go back to the office on Monday if there are no symptoms. I'm concerned if I refuse to go back to the office that I will be fired.
Well, it depends. Depends on how long she's been in isolation and if she has any medical reason to extend that period of isolation. So she should check with her doctor. It also would then depend on whether she's exhausted her rights under the Family First Act, which was the first piece of federal legislation that deals with individuals who take COVID-19 related absences from work. We do have some information about that on our website, so I would encourage her to look at the website. I would also encourage her, if she has questions or concerns, to send the email to our UI claims help at iwd.iowa.gov. We are answering those over the weekend, and we should be able to give her an answer hopefully before Monday morning.
And you know, I have one here, and I want to stay on it too long because it sounds similar, but I want to ask you, it's a case that sounds similar. This is from Jenny. My husband is a kidney transplant recipient. Due to this is immunocompromised. His workplace has not closed down and currently has no plan to. He works in close proximity to others. So the question is, would he be eligible for unemployment if he chose on his own to stay home from work?
I believe as long as he could get a note from his doctor saying that he is in a higher risk category, then under the Family First Act, he would be eligible for unemployment should he then stay home.
That is a high risk group, you know, most certainly.
Yeah, that's what we always are told, right? That the high risk are people with underlying previous health conditions.
And
right?
certainly someone who's received a transplant, you know, because of the type of medications that they take, very high risk.
Mr. Miller, I have a question for you.
David, if I could just jump in
Sure.
and say that the employers that are requiring people to come to work, I just would implore them not to do that unless it's absolutely necessary and just impossible to function unless they do. And in terms of that one individual that is so vulnerable, to require that person to come to work just seems wrong. Just seems that in this environment, with the risks that he or she would have, they just shouldn't do that. I think that's part of what I was talking about before, that we're all in this together. And to the extent that we treat each other right, to the extent that we reach out with generosity and do things that maybe we don't legally have to do, but it's the right thing to do, to go ahead and do, I just would make an appeal to both those employers.
And we have a question here from Rod from Algona. Is there an issue with people crossing the Iowa-Minnesota borders? Should the state be closed to outsiders?
There isn't currently an issue or any regulation that's prohibiting travel between the two states, and I don't think there should be. I just don't see any real necessity at this point. Indeed, if you look at positive cases, Minnesota is doing better than Iowa. In fact, Minnesota is doing terrific on that score. That for per capita cases, they must be one of the best, maybe the best in the country. But in any case, this arose in a more significant situation in regard to New York and to Florida and Rhode Island, and we have to keep in mind that all the states are in this together, and to prohibit travel is something that we just shouldn't do in the current situation.
And while I've got you, General Miller, Steve in Denison, are packing plants going to be allowed to continue to operate?
I think that the packing plants will be, whether there's a stay-at-home order or not, that it's food production is considered an essential occupation, employment, and just having made my weekly trip to the grocery store and seeing the food in place and being able to get what I need. It's very important that food production continue.
Erin?
Well, speaking of the grocery store, Dr. Rosa, Jack from Davenport writes and asked, is there any suggestions or recommendations for people when they go to the grocery store? Is it safe to do that still right now, or would the preferable method be for places that do this, order and have it delivered or picked up curbside?
If you have the ability to get your groceries delivered to your home, that may be ideal. If you are not able to access this type of service and you have to go out, then it's important that when you are out, you maintain physical distance with other shoppers and the people processing your purchases. It's also important that if you can, avoid touching your face while you're doing your shopping. If you can get, hand sanitizer and try to frequently wash your hands, that might also be a good idea. And hopefully we don't have to talk too much about peak hours because people are staying home. So these places are staying, as empty as possible. But then try to do your shopping at a time where you do not see a lot of other folks doing their shopping as well.
How about picking? I'm sorry, but Dave, how about picking up, actual packages, fruits, vegetables, whatever it is? Do people need to be concerned about that and transmission?
It's okay to pick up your groceries, and what people have to be very mindful of is, washing your hands. At every opportunity that you have, put all of your stuff in your cart, and then you load it. You get home, you put it, you get it out, wash your hands, put everything away, store it, wash your hands. That's always the most important part.
Director Townsend, we've got some more unemployment questions here for you. Sure. Marcia in Villisca asks, will a disabled person who does not file for income tax still receive the stimulus money, and will she get it at the same time as everyone else?
So in order to qualify for the $600 a month weekly claim, I believe is what she's talking about, as it stands now, you currently have to be otherwise qualified to receive unemployment benefits. So if she's disabled, she's most likely not receiving unemployment or those types of benefits and would not be eligible. But what I would say to her is stay tuned. The DOL is issuing more guidance in the next week.
Department of Labor.
Yes, and that might be a situation that they clarify in the next few days.
And Luann from Belmont said she's already filed for unemployment, but she didn't upload any documentation. Can she amend it?
Absolutely. You can go back in online anytime and add anything that you need to add or that you've missed. If she's works for an employer, then she wouldn't need to file any more documentation.
She says she's an independent contractor.
Okay, then she would need to upload those documents. She just needs to go back in and reopen her claim, and then she'll be able to attach those documents to her claim. And could I just comment on one
Sure.
thing? I do want to remark on what Tom was talking about, that he hopes that employers are doing the right thing. I believe, Tom, from everything that we've been able to observe, that they are working hard to work with their employees and to make sure that they can also not contribute to the stress but get done what they need to do. We've worked very closely with the Iowa Business Council, with the Iowa Association of Business and Industry. So I know that there are a lot of very caring employers out there.
Yeah, there's just a few bad actors.
And they're there
for
regardless.
Yeah, that's right. Erin?
A couple more for you, real quick, Director Townsend, and this one relates back to something a couple examples we discussed earlier. Ramona from Des Moines asks, for people who do decide to self-quarantine and maybe apply for unemployment benefits, does their employer have an obligation to keep that job for them and give it back when they're ready to return?
I would say most likely, yes. Excuse me.
So, and while you take a drink there, I'll get your next one. Carolyn Ames says she works in healthcare full-time, but also has a part-time job as a self-employed massage therapist, obviously, and she needs that income to help make ends meet with her full-time job. Can she get any unemployment benefits for losing that side work, even though she is still gainfully full-time employed?
It would depend, and what we've been telling people is go ahead and file for unemployment, because if, for instance, you are employed but you have lost hours or your hours have been cut or your wages have been cut related to the virus, go ahead and apply for unemployment. You may be entitled to partial unemployment benefits. So I would encourage her to go ahead and apply and see if she would qualify for some of those partial unemployment benefits. And with regard to your question that I wasn't able to finish, I would say that for those individuals who are quarantined or take advantage of the leave that's available under the Family First Act, those jobs would still need to be available because they are technically still employed. They've had to take time off for virus-related reasons.
And Attorney General Miller, I have a question for you from Renee in Gilman. One of the Iowa PBS guests just said that 80% of the businesses in the state are considered essential. I've heard similar figures. Shouldn't the state take a better look at that to make sure they're truly essential?
That's something that maybe should be done and can be done. I think that the governor's office has looked at this pretty carefully, and they're the ones that are basically making the rules and occasionally interpreting it. This really is a problem nationwide. In Minnesota, it's roughly the same as in Iowa. That there are really pretty broad definitions of what's essential. But there are a lot of things that are essential. Like I talked about food production. The financial system to some extent, to a large extent, is essential. So I think you raise a pretty fundamental point without a really readily clear answer at this point. I think taking a further look at it would make some sense, but you run into some questions of really restricting the economy when you would eliminate some jobs that on first blush you would think wouldn't be essential.
Another question is from Glenn in Black Hawk County. General Miller, what would it take for Iowa to call back the retired medical professionals and or put med students into service?
That's something that probably the governor could do with her authority. Governor Cuomo has done that in New York, and you can't call them back in the sense of force them back. He and other governors, Governor Newsom as well, has appealed to retired medical personnel to come back. And in New York, they've had an enormous outpouring of 60, 70,000 people coming back. So I think that the governor could make that call. And I just mentioned Governor Cuomo. I've followed fairly carefully what he's saying, and I think he's done really a great job in a very, very difficult set of circumstances. The crisis there, the challenges, the number of deaths are just enormous, and also his ability to communicate and explain things and to appeal to the better instincts of people have been really remarkable, in my opinion.
Director Townsend?
The governor has issued an executive order that would allow people who have retired and or maybe their license has recently lapsed, to get back into health care on a kind of a fast track. So she has issued an executive order. I'm not sure the entire range of healthcare professionals it applies to, but she has taken steps to make sure that we can get those people who want to come back and can come back relatively quickly.
And Dr. Rosa, haven't community colleges and some nursing programs moved some graduates out a little early?
Yeah, and also, I mean, in the for the medical force, so to say, the medical schools have already gone through the match process, and that means that medical students who are graduating in in May of this year and slated to start working in July already have a set destination. So that process is through, and it's a matter of will they be allowed to to start earlier.
Just a few minutes left, Erin.
Dr. Rosa, we talked about people with underlying conditions. Linda from West Des Moines would like to know, are people on CPAP machines considered more vulnerable?
Well, if you're wearing a CPAP machine, that might indicate that you potentially have some sort of underlying chronic lung problems, and those can certainly put you at risk for worse outcomes if you acquire COVID-19.
Because we see respiratory issues with the disease
Exactly.
itself. Yeah. Another one here for you, Dr. Rosa, from Karen from Clive. She says she's over 70, has her own end-of-life plan. Do patients have a choice if they're diagnosed with the coronavirus, whether to seek treatment? Can they refuse treatment, I think is what she's getting at here, or is the choice made for them once they're diagnosed?
Okay, so I think a few levels to this question. The first one is a patient will always have voice and choice over what they want done to themselves. So if it is her choice to not seek medical attention, that will be respected. If it is her choice to seek medical attention, then she will be provided that. The issue of treatment is what's a little bit different. Really right now there are no proven effective therapies against COVID-19. Treatment is largely supportive or with essentially experimental treatments.
Dr. Rosa, is it time we mandate testing for employees at grocery stores, nursing homes, public transportation when they start their shifts? Greg in Panora has that question.
Well, at the testing at the I wonder if he's talking about determining via PCR, which is the type of test that we do to figure out if someone is infected. I don't know that there are the resources to do that, nor that it could be implemented. Perhaps he's potentially getting at whether they should have temperature checks or symptom checks, which is something that is being done in healthcare facilities.
Erin, I want to ask all three of you before we close for your thoughts about the things we may have overlooked, but Erin has one more question.
Real quick, and I think I know the answer to this, but it's a question that many people might have. So to hear you answer, Dr. Rosa, Marcy from Ankeny wants to know if you've had a vaccine for pneumonia. Does that in any way provide any protection towards this virus as well?
Well, the vaccine for pneumonia protects you from the bacteria that most commonly causes pneumonia. It does not protect you directly against COVID-19 because that is caused by a completely different virus. Having said that, occasionally bacterial infections can go on to complicate something that started with a viral infection. So it's still a good idea for you to have your vaccines up to date, including your pneumonia vaccine.
General Miller, we appreciate your being with us tonight, and I want to give you a few seconds here for your closing thoughts. A lot of questions from us and questions from our viewers, but what do you think is most important for people in Iowa to remember?
Remember to be careful, to stay at home, to stay away from people, to assume that you might have it, and to assume that the next person you see might have it. To do everything we can to keep this from spreading. And secondly, what I've mentioned before is to be kind, to be good to other people. This is a time when kindness goes a long way. One of the things that a lot of people are doing is they're home and they're on their phone talking to their family and to their friends, and keeping connected that way to try and avoid being sort of an unconnected person, because physically we're somewhat unconnected.
Director Townsend, what are your final remark here?
Sure. What I would like people to know is, number one, how much information is available on our website and how hard the people at Iowa Workforce Development are working to help their fellow citizens. I hope that Iowans will show them the grace and the patience when they do get through on the phone, because this is a staff that is just so committed. They are working 14-hour days, 6-7 days a week, just working very, very hard to provide the kind of grace and kindness that Tom has been talking about. There are also opportunities to work available. There are over 32 employers we have on our website right now who are in desperate need of workers. So there are jobs available, and if you are healthy and want to work, that opportunity exists.
That's good news. Dr. Rosa, your
Stay
thoughts?
home. That's my message. Stay home.
Simple.
Yes.
I want to thank all of you for your service, General Miller, Dr. Rosa, Director Townsend. We appreciate your taking time with us tonight, but we appreciate the work that you and so many other people in public service today are doing for all of us. We appreciate that a great deal.
Thank you.
Thank you.
And we'll be back for another expanded live edition of Iowa Press at our regular times next week, live on Friday night at 7:30, with a rebroadcast at 11:30 on Sunday morning. So for all of us here at Iowa PBS, I'm David Yepsen, and thanks for joining us today.
If you or someone you know is experiencing stress, fear, or anxiety during this time, resources are available at yourlifeiowa.org. Live chat with an expert, text 855-895-8398, or call at 855-581-8111.
Funding for Iowa Press was provided by Friends, the Iowa PBS Foundation, the Associated General Contractors of Iowa, the public's partner in building Iowa's highway, bridge, and municipal utility infrastructure.
I'm a dad.
I am a mom.
I'm a kid.
I'm a kid at heart. I'm a banker.
I'm an Iowa banker.
No matter who you are, there is an Iowa banker who is ready to help you get where you want to go. Iowa Bankers, allowing you to discover the genuine difference of Iowa banks.